Hello, I'm Dr. Neil Minkoff, founder of Fountainhead Healthcare and Chief Medical Officer of ImpairMed. I'm also the former Medical Director for Network Medical Management and Pharmacy for Harvard Pilgrim Healthcare. Welcome to our expert panel discussion entitled Balancing the Benefits of Growth Hormone Replacement Therapy, Managed Care Recommendations to Optimize Clinical, Economic, and Humanistic Outcomes. Our purpose is to help improve the performance of managed care professionals by recommending key strategies and techniques that will lead to better overall outcomes for health plan patients with growth hormone deficiency and other growth-related disorders. Our panel discussion will share best practice solutions to optimize outcomes for health plan patients requiring growth hormone replacement therapy. It is my pleasure to introduce our distinguished panel of experts. Joining me is Dr. Pincus Cohen, Dean, Leonard Davis School of Gerontology at the University of Southern California, Adjunct Professor of Pediatric Endocrinology at UCLA, and President of the Growth Hormone Research Society. Dr. Terry Lipman, Assistant Dean for Community Engagement and the Miriam Sterl Endowed Term Professor of Nutrition, as well as Professor of Nursing of Children at the University of Pennsylvania School of Nursing. Also, Dr. Roger Muller, Market Medical Director, Pacific Northwest Region for the United Health Group. And we are fortunate to have joining us remotely Dr. Mark Malich, Professor of Medicine in Endocrinology at the Northwestern University Feinberg School of Medicine. Each of our faculty will be delivering a brief review of key topics related to growth hormone replacement therapy based on their practice and expertise. Following each presentation, we'll have a panel discussion to allow further insight and commentary from our other expert faculty's unique perspectives. Before closing our discussions, I'd like to call on each of our faculty experts to summarize one or more best practice solutions that will help optimize outcomes for health plan patients requiring growth hormone replacement therapy. Dr. Lipman?
Thank you very much. So I think if I were to summarize, I would say that the most important points are clear and open communication between the providers and the insurance companies. Thorough documentation of all clinical data, laboratory tests and x-rays, and inclusion of all supporting literature that has been published that can help the process move more smoothly.
Thank you. Dr. Cohen?
So I think we've discussed today various issues related to growth hormone management. And clearly this is a complex topic and a topic that's evolving continuously. One of the things that I think is very important to keep in mind is that we should all work as partners, payers, pharmacists, physicians, and importantly, patients and their families. And recognize that all of us should be patient-focused and patient-oriented and try to create a culture where we can communicate, share evidence, share information, and try to find the best possible management for patients, whatever each individual patient might need in terms of a product, a dose, and any other management issue that can help them with their specific problems.
Great. Thank you very much. Dr. Malich, could you give us a few words on best practice solutions to help get patients on therapy?
Well, I think with respect to adult growth hormone deficiency, it's really critical to have good quality data with respect to testing of the patient to be sure that indeed the given patient is growth hormone deficient. And once that information is available, then I think the information suggests that growth hormone therapy is beneficial. How long should patients be treated? I think we still don't know that, but certainly for many years, looking at changes in body composition and quality of life. So overall, treatment of growth hormone deficiency in the adult can be very beneficial for patients, and we often reassess them after a year or two to ensure that they are receiving benefit. And those that appear to not have any benefit, we can stop. But those that are receiving benefit continue to do well.
Thank you. Dr. Muller, from the payer perspective?
Well, thank you, Dr. Minkoff. I think it behooves all parties, much like Dr. Cohen just spoke to to streamline the process of information exchange. And so I think to that end, we need to adjust our templates with expert advice from practitioners or back office personnel in their offices in terms of the information flow. We need to provide online ability to submit that information so that we're not dependent on fax, because we know that faxes can get lost or misfiled. It's best if they get tagged and are put into an online system. I think it's best that in those cases of large practices or academic centers where EMRs can be communicated directly to the plan, we have some of those arrangements. Enhancing those would be beneficial. And then recognizing that there are going to be gray areas in some patient scenarios that we both need to dialogue and exchange further information on.
Yeah, and to that I'd like to add that I think it's very important that everybody on the panel today recognize the need to value both the clinical effectiveness and the patient experience along with the cost of therapy, which cannot be left out of the picture. I also do think that one of the best practices is to make sure that the information that's being provided to the payer is a complete package of information with all of the potential information on the diagnosis and the lab testing to help to reduce delays, and also some education if it's not a reasonably straightforward case, because the person requesting is going to be more educated about the subject than the person who's reviewing.
Absolutely.
This has been a robust discussion today from many perspectives about growth hormone therapy, the barriers to therapy, and collective ways we can work together to address those barriers in a way that's positive. I'd like to thank our faculty panel for their insightful and very valuable recommendations. Thank you.